Welcome to Chats with COLGA. We are celebrating Black maternal health. We know that this is something that needs to be discussed, and we thought it would be befitting to interview you, the Brown family, and share your narrative with us. This is going to be very pivotal, very interesting, and I think very impactful for the community and beyond to hear your story. And just thank you for setting the stage for us. We really appreciate that. And we have Ramon and Bianca Brown with us. And I would like for you all to take us back to that very moment, that time, and share with us what your experience, what happened.
So with our first child, we used IVF because we had a hard time getting pregnant. And so we used a local doctor here, and we were successful with getting pregnant with our first child. And at the time, I was 33 years old and had a very good pregnancy, very healthy. I still walked and worked out. I felt great. We hired a doula, and everything just went well. I had a birth plan, and then when I got to the hospital, everything just kind of went up in the air because the umbilical cord was wrapped around his neck, and so having a natural birth would have put him at risk. And so we had a easy peasy C-section. Recovery was very easy, and he was a healthy baby boy. So about 2 years later, we wanted to have another child, and so we decided to use some of the embryos that we had with the physician, and so we implanted two, and we got pregnant with our baby girl. We didn't know it was a girl at the time, but we got pregnant with our baby girl, and we were having a really good pregnancy. I, again, felt very healthy, and then I started... my feet started swelling, and I just thought it was just a part of pregnancy. I didn't think anything of it, and I went to a routine appointment with my doctor, and she said, "Oh my gosh, your blood pressure's a little high." She said, "I'm going to send you to the hospital." So we went to the hospital I was there for maybe 2 or 3 nights. My mom came in town to help with our baby boy, who was about 2, and they diagnosed me with preeclampsia, which is essentially high blood pressure for pregnant women. And it's very serious and can lead to very terrible complications with pregnancy. And so the way they kind of managed it was essentially they released me from the hospital and sort of put me on reduced activity, not bed rest, but reduced activity. And so I'll never forget the day. I woke up and I went to a meeting that I had at 10 a.m. And one of the ladies there, she's an OBGYN, and she looked at me and she said, "You are very swollen." She said, "You don't look good. When you get home, take your pressure." And so I said, okay, I've been swollen for the last 3 weeks or so. And so I said, okay, I'm going to go home and I'm going to take my pressure. So I came home and I sat on this sofa and I took my pressure, and I said, let me take a nap. Let me relax first. So we relaxed, and I woke up and I took my pressure, and it was, I think, like 160 over something, which was really high. And so I said to my husband, I said, that's not good. And so I think I called the doctor, I believe, and they said, well, just come to the hospital. Let's see what's going on. So we went to the emergency room, and the doctor at the time on call was not my personal physician, but I was aware of him because the practice makes you rotate through all of the doctors so that you are aware of them in the event that they're on call when you deliver. And so I had worked with him before, and when I got there, he said, "Your pressure is very high. We're going to give you an IV drip to try to reduce your pressure." And so I was in the emergency room, and they said, "We can't get your pressure down. We're going to do an emergency C-section." And he said the viability of a 35-weeker is the same about about the same rather as a 40-weeker full term. And so he said the odds are better if we just take the baby now. So he says, we're going to take you in for an emergency C-section. At the time, I was joking around because I'm like, okay, we're going to go ahead and have this baby. And so, I was saying to him, I had asked if he would put me out after the baby was delivered because the C-section, while you're awake, you feel the tugging and the pulling, and I just didn't like that. So I'd asked him to put me out. And so the last thing that I recall in the emergency room on the table when we were having the C-section for the child, I remember the doctor saying that the baby's out and the baby's out, and it was a girl. And so we were very excited because we did not know the sex. And we had prayed for a little girl because on my husband's side, there's 15 grandsons. And so she would be the first granddaughter. And so we were very excited about the girl. And then I recall him saying, okay, you did great. We're going to put you to sleep. That's all I recall him saying we're going to get you all squared away. And then off I went. And so I'll let you take him from there.
At that point, she's under just a little bit. She can hear me talking and we can have conversations, but she is not, she's kind of lucid. So she's kind of, just, okay, yeah. But I'm excited because, like, it's a girl. We prayed for a girl. Kind of, don't tell anybody. But we prayed for a girl, and they took my daughter over and then started bathing her, kind of cleaning her up. And then I went over as well. And then I sat there, kind of wiped her down, and all right, we need to move off. We're going to take her away. And through the process, because we had done this with our first child, we need skin to skin. And I was the first one to really do the skin to skin. So I was like, all right, I'm preparing for that. Let's do it, move on. So I go back over, and, mind you, I was in the first pregnancy, kind of went through the process, saw how it went, and I'm there just happen to turn around, and I look, and they're, doing what they do afterwards, trying to get things together. And I turn around, I didn't seem anything was out of sorts at that point. But then they move her away, and they say, yeah, we'll come back and get you, in a couple minutes to make sure you can bring you over so you can do the skin to skin once we're ready in the other room. So then I sat back down next to her, and then the doctor they're still kind of working there. And, he looks up and he kind of looks around. Everyone, so it's a little bit more tense now. And I could kind of tell the intensity is kind of going a little bit higher. And they say, call in, we're going to do something else. We're okay. We should be okay. No problem. So then a nurse came and got me and then took me to see my daughter so we can do the skin to skin while they, continue the process of, kind of sewing her up or doing what they needed to do. So I sat there maybe 5-10 minutes to kind of do the skin to skin. And I was like, all right, well, can I go back and see my wife, see how she's doing? I want to check on her because I was a little bit worried, but not particular. Nothing had really sparked it like this must be an issue, right? So they get my daughter. It's been probably 10 minutes or so, and then I move and to go back to the delivery room, the emergency room. And when I come up to the window, the door is closed and they won't let me in. So at that point, I knew something was going on and something was amiss, like there could be something significant kind of happening. And the nurse saw me at the door and came out and was like, we got a couple things we're trying to work through. We should be okay. I'll let you know if something happens. I'll be right back out. Immediately, I'll be back out. So that's when sort of panic kind of went up a little bit higher, but, staying kind of relaxed, trying to stay relaxed, rather, and not get overly excited in the hospital. And in the back of my mind, the story of one of my good friends is kind of replaying in my mind to where his wife had a child, and they were in the hospital, and she complained about pain. She was having pain, and they just was not really taking her request or her statement seriously. They were not checking on her, did not run any tests on her as they should have. And this went on for quite a while, and kind of, I think it was the next day, she's still having the pain. And eventually they, had to complain enough to where someone came and, all right, let's run some tests. And come to find out she was bleeding internally, and she died. She passed away right after she had her child. So this is stories going through my mind. I'm thinking, like, this cannot be happening. Please don't allow this to happen. And it seemed like forever, but I'm sitting there, and it could have been 5 minutes, it could have been 30. It seemed like forever. I don't know exactly how long it was, but it was longer than, 5 minutes. But I sat there walking and pacing in the hospital, saying some prayers, and I didn't want to call anyone because I didn't want to alarm anyone either. Because I didn't want to, make it seem as though this could be what it could be, and I didn't really have any answers, right? So I didn't want to kind of be a precursor to anything that could possibly have happened. So I waited, and I sat there. It was forever, and then finally a nurse came out. She is still in there. She's alive. We have a complication. We've tried numerous things, and we can't stop the bleeding. So I'm like, well, what do we do with this? Like, you can't stop the bleeding. Is it not going to stop? Or is there something we can do? She's like, we can't stop the bleeding. I'm going to bring you in so you can talk to the doctor, and he can give you a prognosis of what we think, could help, or, something we should do. So I'm like, all right, bet. Walk in immediately. Doc, what's going on? What can we do? Well, she's it's still attached. We can't detach what was it called?
The placenta was attached to the uterine wall.
Exactly. It was attached to the uterine wall, the uterus wall, and we cannot detach it enough to where it comes clean, and we can't stop the bleeding. We tried to sew it up. It will not. We just can't do anything else, right? So it's like, well, we can continue to try something. It could or could not work. We can wait and see if it kind of comes, or we can make the ultimate decision right now, which I probably would recommend, is we just need to do a hysterectomy and remove everything to tie it up and then tie her up, and that's probably going to be the best. And, knowing the struggle we had gone through to have children, I started immediately thinking about, well, can I make this decision for her? Because she couldn't make it, and would I be, a bad husband taking away what kind of made her a woman? That was a quick reflection of thought, but then the next thought was, I have a girl, I have a son, we've been blessed, and if we don't have any more kids, we will be okay. We've been blessed upon blessed, and if my kids grew up without their mother, I don't know if I could live with that. So immediately, I was like, yes, Doc, do it. Do whatever you need to do. We will deal with whatever we need to deal with on the back end of it. If this is going to be what saves her life, and you are 99% of confident that you can do this and this will work, I'm going to trust in you. Do it, and call me when it's done. So he said, all right. They took me out of the room, said, we're going to complete it, do everything we need to do. And then, I just went back to my daughter, sat there with her and prayed. And, after the surgery was completed and they had taken her and removed her and put her into the ICU, they came back to me and said, we got the bleeding stopped. She is stable. you can come see her. And those words were all I wanted to hear. I went to see her. She was unaware what kind of had happened because she was still kind of, still drugged up, still, trying to recover. But I held her hand, and I was just happy that she was still here. Because, you hear the stories, and, they don't become as real as they are until they happen to you, no matter what happens. It's when it happens to you and impacts you on a individual level, that's a whole nother dynamic, right? So I was very happy. My daughter was healthy. She didn't have any complications. So, that was another blessing that, that could have turned south as well. And, from that point forward, it's always been you are a miracle child. She's our miracle child, and God gave us a miracle of, allowing Bianca to still be here with us.
So I woke up and I was still in and out, and then the doctor comes in and he says, I want to talk to you. And I said, okay. And he said I had to do a hysterectomy. And my first question out of my mouth was, so that means that I'm going to go through menopause? And he said, no, I left your ovaries, but I did do a partial hysterectomy, meaning your uterus and your cervix. And so I said, so I won't be able to have any more children? And he said, no. I have always wanted 3 children. And it took me about 4 years to overcome the depression that I felt. I had to go through counseling. And I felt terrible because I had this beautiful baby girl who was perfectly healthy, which was the blessing in all of it. And I was mourning the loss of the ability to have additional children, even though I had 2 healthy kids. And so I had this level of guilt for feeling that way. I also resented my husband for making that decision for me. And it took 4 years of counseling to understand that my husband saved my life that day. When he told the doctor to take my uterus because I was officially diagnosed with what's called an accreta, which means your uterus attaches to the lining, the uterus attaches to the placenta, and they were unable to separate that. And so for years, I felt less than a woman because I couldn't give my husband a child. I felt, because we've always wanted a big family. We've always wanted 3 kids is what we've always said. And we took a long time before we had children. I mean, I was 37 when this happened. And we had been married since we were 20. I was 28. And so the depression and the loss that I felt was real. And I wrote a letter to my doctor, and through my counselors, he recommended that I write a letter to the doctor, and I thanked him for saving my life because we did have a friend who lost his wife in the hospital after giving birth. But it took me a while to get there. It took me a while to see the blessings of it all. And it took me a while to see that God brought me home with my baby girl. And so going through that process, it also took me a while to understand that my husband made the best decision that day that he could for our family. especially knowing that we had a friend who left the hospital with his 2 children and without his wife. And I did not expect the depression, and I talked to a lot of people about it. I have friends who've had similar types of situations, and they have also gone through the same level of anxiety and depression. I was fearful of hospitals because after that all happened, I had to have blood transfusions because I lost so much blood during the surgery. And it wasn't a terrible recovery, but it was different than the first pregnancy and the first C-section. And so the process for me was different than it was for him, because he walked away thinking that he had made the right decision saving me, and I walked away feeling helpless. Somebody else made this decision for me, and there was nothing I could do. I woke up to this.
Such a powerful, powerful, powerful narrative. Such a powerful story. How things just shifted all of a sudden.
Yes.
In a blink of an eye. It doesn't, you never know what tomorrow holds. You never know what the next minute holds. You constantly have to really be evaluating circumstances and understand that life will throw you curveballs, but how you look at those curveballs, try to hit those out the park, and continue along with life is necessary. Like, we have 2 great kids, and no matter what occurred, things will always be okay for us, because it could have went south and be a totally different dynamic for our family. So always looking to see the good side of things is what I'm always trying to do, and always remind her of the good side of the family. The bad things are going to come, but always just reflect on the good things and the blessings, and continue for us to continue moving forward with life.
And Bianca, you stated that you were in therapy for 4 years. Sharing with women the importance of therapy, what would you share?
So I didn't want to go. My husband was telling me that I was having irrational thoughts about things, and it was really centered around not being here for my children. And it all came from the fear that I had being in the hospital and having to have the blood transfusions and all the things. And so it got to a point where I just felt like I couldn't do it anymore by myself. I was obviously praying about it and doing all the things, but I got to a point where I needed help. I needed someone else to tell me and to talk me through my feelings and my emotions. And some of the activities and exercises that I did, like writing a letter to the doctor, because I'm very grateful for the doctor for making that decision that in a blink of an eye. Because he told me it was just the second that he had seen. It's a very rare condition, and the fact that he was able to adjust and to do what he did, saved my life. And I said in the letter that I was very grateful to him, and I took it to him when I went back for like an annual appointment, and he remembered me. He remembered that day. He remembered the situation, and so. The therapy helped me work through the resentment that I had, as well as the guilt that I felt. And it helped me to see the blessing in it all, because we were able to come home, like I said. My baby girl is everything to us. Obviously, my son is too, but she is everything that we prayed for. And, in church, you hear them say the road is not always easy, but there's always a blessing on the other side. And she is just such a blessing to our family. And this has also made our relationship stronger because, I mean, how vulnerable do you have to be to tell your husband, like, I'm thinking these thoughts, what should I do? And, you know, to go to therapy and to be vulnerable and to be able to say, why am I thinking this? Why am I acting this way? And we had, it was rough for a while. But the therapy was the best thing that I could have done because I started to go from being...
you were a lot more reserved.
I was very reserved.
And anxious, like you were always...
I was very anxious. I didn't want to do anything. I didn't want to travel. I just wanted to be home. And it was really from that experience. It was a traumatic experience for me. And so, my daughter just celebrated her 7th birthday. And my intention was not to cry tonight because I felt like we had done so much work to get here. But hearing his side of it, I don't think I've ever heard it as raw as I did just then. I've heard the story, but to hear him tell his side is really nice to hear that he really wanted our family to stay a unit and to not have to do this on his own. And so I'm grateful to know that he appreciates me.
Of course I appreciate you. And, it is a lot for her to bear. So from a husband's perspective, from my perspective, all I could do was try to support her in the best way I could. Be understanding or try to be understanding of, the feelings that she was having. And, even though, thing is that for me, it was maybe not as, or the things she was thinking about were not as dramatic or not as, bad as she made it. From her perspective, it was everything. Like if someone on TV had an accident and got cancer, she's like, well, is something going to happen? She would reflect on her and she would take it personally. And because of the accident that we went through, everything was just heightened. Like her emotions were heightened.
And internalized.
Yes, and internalized. It was really eye-opening for me to see how impactful that kind of situation could be for someone. So, from my perspective, you have to be willing to go down, understand, and get in bed with everything she's doing as well. Like you have to be there with her. You have to be so supportive to bring her back to you because she was drifting away. So whatever I could do to try to throw a rope to bring her back, if you need to go see someone, if you need to talk to someone, they may be saying the same thing I'm telling you.
And they did.
But it is different.
It is.
Hearing something from other people and
neutral party.
Neutral parties and other
Absolutely.
individuals. That's just, that's almost the key to some relationships, some success. Like I think anyone who's married understands. You may say something, and it may be the exact same thing someone else says, but it may not register until someone else says it. And that's just how life is. But
right.
Being there and staying strong together, talking, communicating, and always in each other's corner, no matter what the situation ends up being, is critical to kind of getting past something like this.
And I still struggle. When I see families with 3 kids, I can't. If I'm honest, I look with a bit of sadness sometimes. Like, I wish, for that 3rd child. And we talked about adopting, obviously, if that would be the right choice for us. But I still do have moments where I'll see a family out with 3 children and I think, that could have been us. But then with the therapy, there's a snap of the finger that essentially says, you have these 2 healthy babies. Exactly. And they give us all that we need. Yeah. Our hands are so full. And so But that's through the therapy, because without the therapy, I would have gone down a rabbit hole. And so, I credit prayer, therapy, and just having a good relationship with my husband, feeling comfortable being vulnerable and telling him how I felt, because it sounded crazy coming out of my mouth, and he never judged me and said, that's not good or that's crazy. He would just say, well, I don't think that's a really good statement, or I don't think that's true, or let's talk to someone. And so that was helpful, because particularly in our community, mental health and therapy is just not something that my parents would have ever suggested, or anyone else. And it was really the best thing that I could have ever done to get through the healing. And I don't know if will ever be completely healed, but I feel okay about it now. I'm comfortable talking about it. In fact, I share with other women who are at my age now having hysterectomies, about my experience with it. And it did not put me in menopause, as I asked. That was the first question I asked. And I'm just very grateful that God saw fit to let me live to see my babies grow up.
And so, Ramon, I do want to ask, do you feel like, because we know sometimes when Black maternal health, there could be inequities. Do you feel like you had everything you needed? Because it seems like everything was unfolding, right before your eyes. Do you feel like you had all of the support you needed by the health professionals? Your questions were being answered. Do you feel like everything you needed was there? And also, do you feel like as a man that you had to be strong?
From our experience, I think we've received the best service that we could have received, because it was, kind of spur of the moment. Everything was moving so quickly. Everything was, had to be done immediately. So there was no time to kind of, kick the can down the street, kind of just move around and just be like, I don't think so. I don't yes, someone is bleeding here. Like, we can't stop the bleeding. So it's hard to say, we just put this off till tomorrow. Like, that's just, you can't do that. So from that standpoint, yes, we received the level of care that was exceptional. And they did make me aware of everything that was going on along the way, and made me feel comfortable that they knew that they could do what needed to be done from that perspective. But, from just overall in general, I do know that Black maternal health is not, looked at or as important to some people. And there are instances where the voices of women are not heard. And as a man, as a father, it is critical for men to be more involved in the process. It is critical for men to get a better understanding of what doctor they may need to see, what the nurse may need to be doing, what any of the other people that are involved in the process or what their responsibilities are, so you can really ask questions when something is out of place. It is very important for you to have a voice when your female partner does not or is not being heard. It is very critical. And if you can do it, and do it in a way where it's, I wouldn't say confrontational, but make sure you're heard, because your voice is always going to be heard. I don't care what is said. If you speak as a Black man, you are heard. And making sure your voice known could save your partner's life. Hands down, guaranteed 100% of the time, if you're there, if you're involved in the process. So I push and motivate more men to get more involved in the process, being there at the doctor visits, being there at any of the birthing kind of things that are going on, even though the doctors may look at you, the nurses may look at you like, why are you here? It is your right to be there. It is your right to be there. You should be there to help support the woman and help to support the baby that you're trying to have.
And I will say, in the hospital, because of what he told me after I woke up, it took me a while to bond with my baby girl. And I remember my husband telling me to hold her, and I didn't want to. And I remember him telling me, when it's time for her to eat, you should feed her, and I didn't want to, because I was still in that mindset of, oh my gosh, these two men just made this decision for me, and now I don't have the ability to have children. And I did not want to hold my child. I didn't want to, breastfeed her. I didn't want to do any of those things. And it was my husband who picked her up, and he opened my hospital gown and he put her on my chest. And then all of that changed. Even though I was still, because I wasn't emotional, I was mad. I was enraged that these men had made this decision on my behalf. And, but when he put her on my chest, the bonding just started, and I was just so happy to have my baby girl. And it was different because after I had my son, I was so excited to hold him and to try to, start with the lactation specialist, but it was so different in the hospital. But I would say day 2, all of that just kind of went away. But, I'm grateful for the doctors. I do understand, I believe Black women are more predisposed or, more likely to have preeclampsia, which is it could be a very serious complication for the pregnancy. But, I felt as if they handled that properly and handled the process well. But we have friends who it didn't go so well for them. And so I'm grateful for the team that we had and for my husband and the doctor making that decision. I'm no longer enraged by it, but I am grateful for the medical care that we received.
Very good. Well, I can certainly see the emotion that both of you all carry. I can see the love that you all carry and that it exuded here today. Again, we just thank you for sharing your story. I know that it will impact so many here on COLGA Chats. Thank you again for inviting us into your home.
Absolutely.
And
great. It's been a little therapy for us today.
I know, it was. It was very therapeutic.
Wonderful. Thank you both so much.
So I hope our story helps someone else.
Absolutely.
That's it.
Absolutely.
Thank you.
Thank you.
both. Yeah.
Thank you.